Good afternoon, North Dakota. Thank you all for tuning in this afternoon. Appreciate that very much. Today on the program, in addition to myself, we'll have Molly Howell, who's the North Dakota Department of Health Immunization Program Manager, will be speaking, and then Michelle Detloff, the Epidemiology and Lab Capacity Program Director, will be on standby for questions if anybody has them. But again, thanks to all of you that are tuning in, and thanks to our media who's attended now nearly 80 of these briefings. As everybody knows, we are nationwide still in the grip of a COVID pandemic, and we see that many states across the nation that have had relatively slow summers or fall are now starting to see their cases escalate in combination with the annual winter flu season. The national, meaning the entire U.S., 7-day moving average for new COVID infections surpassed 200,000 per day for the first time on Monday, the 7-day average of coronavirus deaths in the U.S. is near the April record. Now that's significant because last April we knew very little about this disease. Now we've got therapeutics, we've got new approaches, and the death rate has gone down as a percentage of infections, but those that are dying are nearing the records we had last April. So those numbers continue to climb, and sadly they would be expected to be a trailing indicator with cases. So we expect as we head into the holidays that the nation will still be in the grip of this pandemic. But fortunately, here in North Dakota, our numbers are headed in the opposite direction of nearly the entire nation. And this is certainly today a key point of gratitude that I want to share with all of the citizens of this state, because it's your actions that are leading to those outcomes. In fact, North Dakota is one of only 5 states to see the daily cases go down in the last week, according to the Johns Hopkins data. And today at 4,554 active cases, that's a full 56% below our peak active cases of 10,373 back on November 13 when we put in some of the mitigation measures. And according to the CDC's ranking of states by the average daily case rate over the past 7 days, North Dakota ranked 16th. Which is, again, great that we're going down, because we led that list for a while on a per capita basis. And then on test positivity, even better news, but on Monday of this week on CDC's ranking, North Dakota was 38th in the country, or lower than all but 11 states. This is our first press briefing together since Thanksgiving, and we're grateful to everybody in our state who did their part to limit the spread. All of us have friends and family and neighbors who had their perhaps most intimate, in the sense of most smallest number of attendees at Thanksgiving, and that was, I'm sure, new for many people. Lots of people did interesting and new and creative ways to stay connected with their kids and their grandkids and their friends and their families far and wide, but people limited the size of their household gatherings, and then they also reduced their travel. And of course, this action was key, because here we are now coming out of Thanksgiving, and we're continuing to see our cases drop as opposed to increase, as we're seeing in many other parts of the country. Through contact tracing, which only captures a portion of the data, so think of these as minimums, not maximums. But through the contact tracing, our Department of Health found that there was 576 people who attended a Thanksgiving gathering who tested positive. And of course, those people didn't go to those Thanksgiving gatherings knowing they were positive, but they came out afterwards and either because of symptoms or other reasons got tested and found out they were positive. Of those 576, 227 of them reported that they actually had gathered with people during an infectious period based on the tracking of their symptoms. So again, we encourage people, if you have COVID symptoms, to avoid gatherings of any size. Others develop symptoms after the event, so they were the part of that group, which again continues to track that we've got many people that are able to infect others but don't have symptoms at the time. And all of this data coming out of Thanksgiving, well, we're fortunate that we haven't seen if you will, a Thanksgiving surge or bump like virtually every place else has. Again, credit to great North Dakotans for your thoughtfulness and your consideration of those that you're protecting, not only in your family but others in the community. But it reinforces the need for us as we look ahead to Christmas to be thinking about limiting gathering sizes and staying within existing households who you already have contact during the upcoming Christmas season. If we can keep this trend going through December, keep our active cases trended downward, we're going to have a much happier holiday season. And I think, again, people can continue to be creative in terms of the ways that they can connect and celebrate virtually. Again, continue to avoid travel over the holidays that are coming up. Keep your group sizes small. And if you feel ill, best to stay at home and protect yourself and others. Why the extra effort for the next month coming up? Well, we're so close. Vaccines are on the way. The first shipments are coming to North Dakota soon. Molly's going to talk about that. But this is the home stretch for us as North Dakotans to continue to participate in mitigation that helps save lives and livelihoods. But are we out of the woods completely? No. Even though we're going down and the rest of the nation's going up on a relative basis in terms of cases per capita, well, North Dakota did lead the list for a while in the highest new cases per capita, and that can be attributed in part to our efforts that we had in terms of all the great testing we're doing. Our hospitalizations and deaths remain far too high. We'll talk about that a little bit more today. But in the White House a report this week, they had asked public health officials around the country to share this advice, and so we're joining and supporting our public health officials both at the state and local level by sharing this directly from the White House report. If you're over 65 and have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked due to the immediate risk to your health, and you should consider having groceries and medications delivered. Flip side, if you're under 40, you need to assume that you possibly became infected during the Thanksgiving period or during any other time where you might have been in an indoor public space with those that weren't masked. Most likely you will not have symptoms, but you do represent, as we saw in our own data here in North Dakota, that your ability to infect others makes you a danger to others, and you must make sure that you understand that risk and isolate away from anyone in your family or friends or coworkers that might have increased risks for severe disease, and also get tested. Important to know your status. Back again, if you're over 65 and you've got significant medical conditions and you gathered outside of your immediate household, you also, put yourself at significant risk. And so if you develop any symptoms, don't assume it's a cold, don't assume it's a flu. If you develop symptoms, then be tested immediately. The majority of the therapeutics that have been developed for COVID work far better earlier in the infection stage. So you can save your own life and perhaps save yourself time in the hospitalization if you seek care immediately, if you suspect that. I know it's a hard thing. If you think, hey, I've got COVID, you mentally probably just want to convince yourself you don't, but make sure you understand the symptoms and get tested. And so again, as we look ahead to the holidays, there's lots of testing opportunities in North Dakota. And if people are going to be gathering, we encourage people to start planning now. Either start an isolation period of your own for several weeks to make sure that you're not infected, or if you're unable to do that, consider getting tested before you put yourself in a position of being around vulnerable adults with underlying condition. Let's take a look at the numbers. And with 4,286 new cases this week, which is, again, still a significant number of cases, but we've outpaced that substantially with 6,582 newly recovered cases and, sadly, 102 deaths in 1 week, just in the past week. We are now at 4,554 active cases. As I said, that's more than 50% reduction from our peak on November 15th, so that's great. But 4,286 new cases in a state the size of North Dakota is still something we have to take very seriously, because at that rate, it's still a per capita basis higher than most all other states. When we take a look at the PCR tests, which we're reporting here on this slide, those that tested positive versus those that had tests completed, this brings our past 7-day positive test rate to 8.4% among all North Dakotans tested, and we are happy to see that rate coming down. The 14-day rate, which we'll talk about in a little bit, remains higher than that, but we want to see this number get below 5% and even lower. Just as a note for those that are liking to track stats, the antigen tests, which we'll also talk about later, they're not taken into account into the percent positivity because, well, we are rolling out antigen testing. We do not have reporting completed for all of those, so we don't know the total of all the number of negatives and the tests completed, so we can't yet report a positivity rate on the antigen tests. This week is past total. Again, a good testing week, over 50,000 tests completed. 10,814 of those were people that were tested for the very first time, and others, perhaps those in long-term care or frontline healthcare workers were included in the 43,000 people that had repeat tests. We have now completed nearly 1.2 million tests of North Dakotans and close to 360,000 unique North Dakotans. And so that is, again, credit to all of the great work that's going on by everybody involved in testing, because that is helping us to identify, helping us to isolate, and helping us to reduce the spread. There are still 284 North Dakotans that are hospitalized as of today due to COVID-19. And again, that's a distinction from with COVID-19, but these are people whose hospitalization was driven by COVID-19. That's down from a record of 341 on November 22nd, but you can see from this chart, which goes back to the end of September, where this begins, where we had this very rapid increase, where it took us only a few weeks to go from 100 to 200, and even less time to go from 200 to over 300. That was what was driving us. We always said from the beginning that we were going to be watching hospital capacity as one of our guides, and we know that hospital capacity is driven not by beds, it's driven by the ability to have staffed beds, and we saw that with the community spread that we were having in our state, that we were losing a lot of healthcare workers, not losing them literally, but in terms of them being unable to work due to either direct exposure or actually contracting COVID. And so we have, again, continuing to keep our eye on hospitalizations still being too high, and of course, and again, as we said, deaths still being too high as well. But again, it's nice to see hospitalizations flatten out, and if we continue to see active cases going down, we can be hopeful that in the weeks ahead that we'll see hospitalizations continue to decline. It's important that does decline hospitalizations because, again, as we get into December and January, that is always every year the peak demand for hospitals occur during the heart of the winter here due to flu season. And so it's important that COVID hospitalizations are going down as other hospitalizations may be going up, because we have to manage all hospital capacity for all reasons, not just for COVID. When we take a look at the 14-day rolling average, or even before we do the 14-day, we're not going to go there yet. We're just going to take a look at the Midwest is what we're doing right now. And again, we've talked before about there being a COVID storm that was centered in the Midwest. This storm is spreading. We're seeing record increases on coming back in other parts of the country, the Southwest, Oregon and other states on the West Coast are starting to see surges. We're starting to see big increases back on the East Coast, which really was ravaged last spring. But here in the Midwest, it continues to climb. You can see some of the case numbers here. Over 65,000 new cases in the last period of time in Illinois, 37,000 in Minnesota, 31,000 in Wisconsin, and 6,000 in South Dakota, 6,000 in Montana. And so again, these are the case counts in the last 7 days as reported through today, December 9th. When we take a look at the positivity rate here, again, you can see some startling numbers in the Midwest, where we've got 4 states that are above 30%, Iowa at 38.7, Kansas at 43.1, Idaho at 50.4, and South Dakota at 51.5. And again, North Dakota, among the 19 states shown here, or I should say among the 14 states shown here, it is the lowest of those 14 states. When we take a look at our 14-day rolling average, we are pleased to see this number. We've talked a lot about bending the curve and slowing the spread. That's happened. Again, credit goes to everybody in North Dakota. It's what everybody does, and the individual responsibility that people showed as individuals and as families, the choices they've made, the sacrifices that people made, being able to make some changes in terms of taking a bit of a pause on high school sports and gatherings in that manner. All of these things combined, the business owners that have been complying with the earlier closing hours and the limitations, event closures, everybody that's been touched by this is playing a part in seeing these terrific numbers. So again, this is the 14-day average at 9.4%, which is higher than the 7% one we've seen, because we've had this 14-day average includes higher numbers from more than a week ago, but we're very encouraged by the trend, but we need to get under 5%. It's a goal we can reach, and if every North Dakotan keeps doing their part, this is on the easy part. We're going downhill now. Just keep doing what you're doing, and we're going to continue to have success. But when we take a look, again, as I said, we've seen in the last short period of time, of the 86,149 positives, we've seen 80,515 individuals recover. That is the highest percentage of recoveries per capita in the country, we believe. And so again, we can be known as the recovery per capita winner in the country. But sadly, we still have got too many deaths. We're up to 1,080 deaths, 102, as I mentioned, just over the past 7 days. And anyone whose family has been touched by this horrific and cruel disease, our hearts go out to each and every one of you who've lost a loved one during this pandemic. When we take a look at active cases statewide, it's fun to now see some white counties showing up on on this chart, and by that I mean that these are counties that have no active cases. We went for a period of time during this fall where every county always had active cases, and so and it's fun because some of these counties, including Emmons, had among the highest per capita counts last September, October, and now they're back to no current active cases. So it just goes to show what can be done in a short period of time when North Dakotans put their minds to it. Case counts across the state have decreased, but of course we do see that even with the decrease, we still end up, of course, in our population centers. Our 4 most populous counties, Ward, Grand Forks, Burley, and Cass, have among the places where we've also got the highest number of cases. There is over 1,000 in Cass County. Burley, Morton, respectively, which together have less population than Cass, has got 838 cases between the two counties. And then we have a few other counties that have more than 100 cases, Grand Forks with 388, Ward with 353, Williams 159, Stutzman 155, Rolette County 154, Stark 149, and Richland 127. And I think is there one other slide there that I may have skipped over that talks about the cases per population? Nope, that one got removed. Okay. Anyway, so that's not in there. But I was going to say there are some rural counties in the east center part of the state they've got lower actual cases. They are right now the hottest spots in the state in terms of the number of cases per population. So again, even if you've got a low number of cases in your county, make sure you take a look at the data because we still have widespread presence of COVID around the state, and we need to snuff it out everywhere. The next topic is executive orders and the state health officer mask mandates. As I'm sure you all recall, on November 13th, at a time when we had a record number of cases and extreme pressure on our healthcare system's ability to deliver healthcare and hospital care to both our COVID and non-COVID citizens, we announced several mitigation measures that were aimed at slowing the spread of COVID. And while we're never going to be able to know exactly which of these variables made the difference, and certainly actions taken by local entities prior to November 13th and the actions of individual citizens and their individual responsibility or businesses prior to that also had a factor. So this is everybody in it together, and everybody that was involved in any level of mitigation at the local, the state, at the personal level needs to take pride in the outcome that we've achieved together, because together we were able to protect the vulnerable. We were able to ensure hospital capacity for COVID and non-COVID, and we kept striving to keep our schools open and keep our kids in school learning on premise, and also to keep our economy open. But of those orders that we had, one was through the state health officer powers that they have requiring face coverings to be worn in indoor businesses and in indoor public settings, as well as outdoor public settings when physical distancing wasn't possible. That was one of those. An executive order was issued by myself with capacity limits for restaurants and bars, including a 10% or 10 p.m. early closing time, which again still allowed for takeout, curbside, and delivery to be delivered after 10 p.m. Through to the 4 a.m. time frame. And then we also put capacity limits for banquets, ballrooms, and event venues, as was described in our North Dakota Smart Restart large gathering tiered capacity document. Under the existing orders that were issued on November 13, these measures would have expired come next Monday. However, given that we still have hospitalizations that are near 300, and we still have among some of the highest COVID per capita in the country, we are extending these orders. The state health officer has extended the mask requirement until 12:01 a.m. on Monday, January 18th. The purpose of this date will allow for a 14-day incubation period to pass after the Christmas and New Year's holidays, and that will certainly give us a clear picture of our trend line. And again, hopefully when we're in the first weeks of January, we'll be looking at the same kind of data we are now coming out of Thanksgiving, which is numbers that held flat and then began in a downward trend. And so again, if we can North Dakotans, keep doing what you're doing. Do what you did on Thanksgiving, and if we can do that, and even better, we're going to get through Christmas and New Year's and be among the states that is going to be in the best position to emerge stronger for this. Monday, January 18th also is significant, because by Monday, January 18th, we will have received multiple, not just our first tranche of vaccines, but perhaps multiple tranches, and by that timeframe, we'll be on our way to vaccinating frontline healthcare workers who have direct exposure to COVID and will have been at least through the first round. Many of these vaccines require two shots, but we'll be through the first round by that time of our people in long-term care. And so we also know that the legislature last week met, and they right now, with the rules they passed, plan to begin their regular session with a mask requirement in place in the first week in January. We look forward to working with the legislature on all of these topics and collaborating with them, with having them back in session. Also, the measures for bars, restaurants, banquet, and ballroom events, those will be extended through executive orders from next Monday, extended to 8 a.m. Friday, January 8th. And you might say, why is that an earlier date than the mask mandates? Well, first of all, this gets us past the holiday and events that lend themselves to high transmission, such as holiday parties, private holiday gatherings, and New Year's Eve events, both public and private. Yes, it's a shorter period than the mask requirement extension, but it recognizes that the economic impact that these capacity limits and hours of operations have on the hospitality industry and people's livelihood. Before we leave here today, I'm going to be giving an update on the Hospitality Emergency Resiliency Grants and the Hospitality Emergency Resiliency Grants Plus, which are available for relief. We'll talk about that more in the program. We did also, back on November 13th, required a pause in high school winter sports. We deferred practice to beginning on November 30th, which it did. We delayed the beginning of competitions until December 14th, and those suspension of activities is going to be allowed to expire on December 14th. So that means that there will be a resumption of K-12 extracurricular activities and competition beginning on December 14th. We will continue to work closely with the North Dakota High School Activities Association on limiting opportunities for virus transmission. Earlier today, that association voted to align their spectator guidance with the North Dakota Smart Restart tiers for events and gatherings, which can be found at ndresponse.gov. And by doing that, that actually was an increase in the number of people that can attend high school events when they changed an earlier decision that the North Dakota High School Activities Association made. They've now, in part based on the good numbers and the good work of North Dakotans, feel comfortable raising the attendance limits to match the North Dakota Smart Restart tiers. Of course, we believe in local control, and school districts may implement more restrictive measures regarding spectators and school-sponsored activities within their districts and within their facilities at any period of time if they find themselves in a situation where they've got either people at risk or in the middle of a more localized breakout. They have control to be able to do that. We also want to say that we're grateful because we know that people love their high school sports and their school pride in their local communities across both Class A and Class B in North Dakota, and we are grateful for all the TV and radio stations and the online streaming services that are carrying these games, which are allowing people to watch and listen and cheer on their teams, particularly those grandparents who love watching their kids. Allows them to remain safely and cheering on their family until such time that we can get those that are elderly and vulnerable vaccinated. And so again, thank you to the sports media for doing this. As many of you have noted, the mitigation measures collectively that we're using appear to be working, but it's only due thanks to your individual actions. So again, at the heart of this is individual responsibility. It's commitment to community. It's commitment to your team, to your teammates, to your school. It's compassion for your loved ones. It's a commitment to all of our healthcare workers and frontline workers. So let's keep continue making progress by all doing our part, and let's keep our schools and the economy open. Let's keep the numbers going down, and let's reduce that pressure on our healthcare system, because these are the workers that are on the front lines every day. They're giving it their all to save lives from this cruel virus. And again, if something happens to you, whether it's a heart attack, a car accident, or if you come down with COVID, you're going to want to make sure that you're going to have a rested and well equipped and well staffed healthcare system waiting for you, and that's what we want to provide for everyone. And again, we're asking with these extensions, these are not forever. Certainly the actions we've taken already has helped us save the winter sports season. And so again, thank you all for doing that. And we've got a big light at the end of the tunnel, and the big light at the end of the tunnel is the amazing advances in modern biosciences that have delivered for us multiple effective vaccines. And we are close, very close to the beginning of distributing that. And if we can limit the impacts of COVID by taking individual responsibility and by demonstrating what we've always done as North Dakotans, which is caring for our fellow North Dakotans, the individual choices we can make can truly save lives. And as you heard from the Department of Health's briefing last week, the first doses of COVID-19 are arriving shortly. And here to give an update on this topic is the Department of Health's Immunization Program Manager, Molly Howell, and she is doing a fantastic job. There's stairs right there. Great. I thought you were going to do like the 36-inch box jump at the gym there. I was like, very impressive. She's been working out, I guess, during COVID. But anyway, Molly, thank you for all your work. The vaccination, very, very complex. Molly is on calls every day, not only within the team here, but with the CDC, the FDC. Then she serves on some national ethics boards. She is up to speed on everything that's going on, and we're very fortunate to have her. And I'm grateful for the many briefings that I've received from Molly and her team and the North Dakota Advisory Committee on COVID-19 vaccination ethics. They've got a plan for distribution as they become available, but pleased to have her today. Thank you, Molly, for all your great work. Thanks to your team, and thanks for giving us an update today.
Thank you, Governor Burgum. So today I just wanted to provide a brief update. I know I just chatted with all of you last week, but there have been some positive developments related to COVID-19 vaccine. And so the positive news this week is that the Food and Drug Administration confirmed what Pfizer had previously released regarding their safety and efficacy data at 95%. And that information was made public a couple days ago and is available on their website. And tomorrow, their advisory committee, the Vaccine and Related Biological Products Advisory Committee, is meeting and will discuss the clinical trial data related to Pfizer and determine whether that vaccine should receive an emergency use authorization in the United States. I also want to mention other positive news from that data is the vaccine is showing strong protection after even one dose. It is a 2-dose series, 21 days apart, but it's showing about 82% protection after one dose. Now, having said that, the vaccine will still be recommended to have 2 doses because we do want that 95% efficacy, and that second dose is needed to boost immunity in individuals. So if tomorrow the FDA does authorize an emergency use authorization, vaccine could ship as soon as 24 hours to North Dakota after that EUA. We don't have official notification yet as to when we'll receive that vaccine, but we are expecting it even possibly this weekend or Monday. And then North Dakota, as stated, will be receiving 6,825 Pfizer doses. We have already placed the order for those doses, and so the manufacturer has our order. The doses will be going first to the referral hospitals in North Dakota and their frontline healthcare workers to ensure that we have continued hospital capacity in the state. And when I say 6,825 doses, I just want to make it clear that that's actual 6,825 people that can be vaccinated. The federal government is holding back the second doses for those individuals. So in 3 weeks, there will be 6,825 doses for those individuals that receive the vaccine. The Moderna vaccine, which is also close, our initial allocation of that vaccine, if approved for use next week, which they're meeting on December 17th to discuss that vaccine, will be 13,000 doses. And then for both of these vaccines, we'll be receiving weekly allocations and equitably distributing them across the state of North Dakota. Also this week, on Friday and also on Sunday, the Federal Advisory Committee on Immunization Practices is meeting to discuss recommendations for COVID-19 vaccines and which priority groups should receive the vaccine first. This committee uses scientific data, implementation information, and ethics to make their decisions, and those also are open meetings, and so the public and the media are able to listen to any of those meetings, and there's also comment periods at those meetings. I will say, though, last week already, as I mentioned, ACIP did vote to recommend that healthcare workers and long-term care residents receive the vaccine first, and that's what we plan on implementing in North Dakota. And just to put it in perspective, in North Dakota, we have about 70,000 healthcare workers and about 12,000 people residing in long-term care. And so our initial allocation is only 6,825 doses. So people will have to be patient in waiting to get the vaccine, but we will try and get it out as soon as possible to those who need it. Governor Burgum mentioned our COVID Vaccination Ethics Committee, which is made up of 5 individuals who are trying to prioritize within ACIP's priority groups the Phase 1A priority list, which is healthcare workers and long-term care residents, is available on our website. And so they provided tiers for vaccination within Phase 1A of who should be vaccinated first, since we do have such limited quantities of vaccine. It is likely that long-term care residents and staff will start being vaccinated within the next couple of weeks, as they are very high priority for vaccination. We want to ensure that they receive access to the COVID-19 vaccine. There is a federal pharmacy partnership program, and so the federal government did contract with CVS and Walgreens, and for North Dakota, Thrifty White, to vaccinate a lot of these long-term cares. And so we've had about 136 facilities in North Dakota sign up for that program, and the remaining facilities will be vaccinated by an independent pharmacy, or they'll vaccinate themselves, or through local public health. And so we are getting a lot of questions and comments from the public wondering when they can get vaccinated, which is good. It's sounding like a lot of people are interested in COVID vaccine. And so it's likely that the general public won't be able to be vaccinated until the spring of 2021, as we are going to move through different phases of people who are at higher risk for severe COVID disease first. It's also likely that pregnant women and children will not initially have access to the COVID-19 vaccine because they were not included in the clinical trials. But I do want to let everyone know that once vaccine is more publicly available, they'll be able to go to vaccinefinder.org and find a provider in their area that is offering COVID vaccine. We'll also be at press conferences and posting on social media and plan a communication campaign. And I just wanted to reiterate the importance of continuing social distancing and masking and complying with isolation and quarantine. We do have a vaccine that is coming, but it will take a bit for enough people to be vaccinated for us to see the impact that the vaccine will have. And so I just want to stress to continue those measures until we have a majority of our population vaccinated. And then just one last comment. I know there are some concerns about vaccine hesitancy or questions around whether or not to receive the vaccine. I just want to encourage everyone to talk to their healthcare provider or a reputable source on vaccines, including the Centers for Disease Control and Prevention, the Department of Health, to make sure you're getting correct information about the vaccine and that you're able to appropriately weigh the risks and benefits of vaccination. But a decision not to be vaccinated is likely a decision to someday develop COVID disease. I mean, this virus isn't going to stop. The only way to stop it is through vaccination. And so inaction is also a decision that you're making to potentially get the disease. And so that should be taken into consideration. I encourage everyone to go to our website. We have a pretty good FAQ on our website that has a lot of questions and answers that we've been receiving, and we keep that updated regularly. And thank you for your time today.
Thank you, Molly. And Molly will be back at the end, available for questions as well. The next topic is a brief update on antigen testing, and let me talk about the benefits of rapid testing right off the bat. The first is for those that are concerned about the cost of the response. These rapid tests are far lower cost. Some of the PCR tests, which require collection, transportation, lab work, reporting, we might have by the time we're done $125, $135 per test into those tests. The rapid tests that are available right now are $5 tests commercially available. The federal government has paid for those and are distributing them to the states at no cost. And so we've got a free test. And when they're fast, I mean, we can get results in 15 minutes versus 2 or more days. They're very easy to administer. And we're also working now for some CLIA waivers where we would minimize the support needed from medical and state staff. And also, if we can do this in a batch process where people may be to do what they call an observed self-swab. So you would swab your lower nose yourself in an observed thing. If you're doing that, you're not required to wear PPE, personal protective equipment, and so that's not required. And so the observed person could be managing that from a medical standpoint, but we would really reduce the need for PPP as well. And now we have been shipped to the state of North Dakota now, all total about over 500,000 Abbott Binax Now antigen rapid tests. And a lot of work has gone into integrating the Binax Now test into our overall testing strategy. In recent weeks, we've identified and built out an entire team of program managers to target different groups. And we've been doing some testing, and tests have been made available in medical settings. We've been using them in long-term care, hospitals, clinics. One of our other goals has been to broaden our testing in long-term care, where we saw too much disease and too much death, and we would like to move from testing once a week to twice a week, particularly if we can do this with between now and when we can get people vaccinated, we can help identify far earlier any spread that may be occurring on or any virus that may be entering one of those facilities through someone that works there. If we are able to go to twice a week, one of those tests would be a PCR and one would be a Binax rapid test. We've also announced just before Thanksgiving that we began conducting pilot tests in K-12. We continue to make progress here, and we're going to work closely with Superintendent Baszler, the Healthy Return to Learning team, and local school boards and local superintendents to get even more schools in this process. But a lot of schools are very interested. This is not, when I say schools, we're not at all testing students. This is about testing teachers, staff, cooks, bus drivers, absolutely people that are essential to our students' education and who are in contact with lots of people who may be asymptomatic but could be carriers. And but we've already worked with Dickinson, Fargo, and West Fargo schools to do pilot tests. And just this week, Wilton and Ray and Richland 44, across 2 of their buildings, we conducted their first Binax screening event for school staff. We're currently working on training personnel to test 20 additional schools and assist them with incorporating the software used so we can get all the results reported out. And tomorrow, there's going to be a meeting with the North Dakota University system to lay out a plan for introducing Binax test on campus. We're also in contact with first responder groups, North Dakota sheriffs and fire chiefs, and there's also a meeting scheduled Friday with the Greater North Dakota Chamber and local chambers to include some businesses in this broad testing strategy, because we have some businesses that may be considered essential businesses that are already trying to figure out how to test their team members weekly, and we want to team up and help work on that. Again, this surveillance testing with rapid response allows us to isolate people with a high viral load to light up a Binax Now test. It's likely that you're in that day 2 to day 7 to day 10 frame, and so it's going to be a very helpful tool to immediately know if someone is positive and get them out of contact with others. We believe that this rapid testing at this scale is going to create an additional competitive advantage for North Dakota in terms of us eliminating the virus. At the same time, we're hustling and doing everything we can to effectively distribute the vaccine in the highest priority way. The next topic has to do with the Hospitality Economic Resiliency Grant Plus, with a little plus sign behind it, or HERG Plus. And our Department of Commerce team continues to work tirelessly on grant opportunities to help provide the much-needed assistance for both consumer-driven businesses and the hospitality sector. And yesterday, we opened up the round for the HERG Plus. This expanded the existing HERG program to provide funding for the accommodation sector, which includes hotels, motels, lodges, and resort establishments. And this is a sector that was particularly hard hit when travel was curtailed. And this is a very targeted program using the coronavirus relief funds to assist the state's hotels, motels, and lodging business who've been impacted by loss of revenue due to low occupancy. These businesses serve a pivotal role in our communities, not only for visitors and tourism, but for local workforce, the jobs they create, and supporting businesses that rely on them. Eligible facilities may apply for up to $40,000. Applicants with more than one facility may apply up to $80,000, with a maximum of $40,000 per location. And funds may be used for eligible entities for costs like operations, payroll, rent, utilities, and other expenses that comply with the CARES Act, federal or CDC guidelines. And these expenses must have been incurred after March 27th and no later than the date of the application. So this is reimbursement for eligible expenses. Applications will be considered first come, first served basis. Funding will be approved if the application meets all criteria and funding is available. You can find out more at belegendary.link/PHERG. And so far, Commerce, even though it's just open, they've received over 100 applications totaling nearly $5.7 million in requested relief. And for the most current updates on all Commerce grant programs, including the ERG and the HERG, you can go to ndresponse.gov. Next topic, driver's license renewals. NDDoH would like to remind North Dakota drivers that all driver's license which expired after March 31st or after March 1st of last spring are due for renewal by December 31st. Again, people might remember that last spring when we were at the onset of the pandemic and closed in-person government offices out of precaution last spring. At the same time, through executive order, we extended certain expiration dates, and that gave people more time once we reopened to be able to get back in. And so with executive order 2020-36.1, which was issued on August 10th, the final deadline for all of those renewals was December 31st. And so NDDoH has been setting records, working hard over the past several months. There's still work to do. Their records show that there are over 10,000 driver's licenses this year that need to be renewed by the December 31st deadline. Don't wait till December 30th or 31st. Reach into your pocket, pull out your license right now. If it's if it's past deadline, then you can either make an appointment or you can renew perhaps online. DOT continues to provide driver's license services by appointment only. No walk-in services are available, but you can, in some cases, you may be able to do this online. So check it out at dot.nd.gov or by calling 1-855-633-6835. And many driver's license services, such as change of address, renewals and replacements, and more, are available online. But if you need to do an in-person renewal, make an appointment today. Thank you. And next update, a behavioral health update. As you know, we've included these since the very beginning because we know that we're concerned about holistic health of North Dakotans, not just their physical health. And we know that during this time of both economic and public health stresses on citizens, and during COVID, people may be unsure about exactly where they can go for help. Something as simple as, hey, I'm feeling alone. Is it normal to have these feelings? How can I find help for my aging parents? We want people to know that help is here. The North Dakota Behavioral Health can connect you with information, resources, and supports built specifically for North Dakotans. For the issues are big or small, we want you to know that help is here when you need it most. And to connect to behavioral health services, support in the behavioralhealth.nd.gov. Help is here. Check it out. Don't be afraid to reach out because there are people there ready to help you. We're going to close out with gratitude, and then we'll go into our question and answer piece. But last week, on December 3rd, we're grateful that President Trump issued an extension of Title 32 of the Stafford Act. This authorizes the National Guard to continue supporting the COVID-19 mission at 100% federal cost share through the end of the year and a 75% federal cost share through March 31st, 2020. That was set to expire. The prior authorization was going to expire in mid-December. But we're incredibly grateful. We had sent a letter of request to the White House asking for this extension and to all the right military channels, but we're grateful to have received the extension because it recognized the importance of the North Dakota National Guard, the role they have played and continue to play in the ongoing COVID-19 response. Beginning with their first activation on March 16th, in the very earliest days of the pandemic, the members of the North Dakota National Guard have been invaluable partners on this incredible mission to save lives and livelihoods. The North Dakota Guardsmen have supported and will continue to support the response to this pandemic with a myriad of tasks. These include everything from directly administering COVID-19 tests, strategic response planning. They've done deep cleaning at long-term and congregate living facilities. They've aided in transportation of test specimens across our state. They provided tremendous support to the state laboratory in Bismarck. And in fact, we now have set a new record in the history of North Dakota. The statewide COVID-19 response now has the largest number of deployment days and hours. It's the largest and longest mobilization in North Dakota history and the storied history of the North Dakota National Guard, outpacing all other prior natural disasters or challenges that the state faced. More than 680 North Dakota National Guard soldiers and airmen have served on COVID duty for 267 consecutive days, totaling 67,495 personnel days, and 270 Guard members remain on COVID active duty today. So on behalf of all of us in North Dakota, I want to thank General Dorman and his great team of leaders, and I want to thank all of the soldiers and airmen of North Dakota National Guard and Air Guard. We got the best in the country right here, and they're proving it once again with how they're serving each of us and all of you during this time period. So thank you. In closing on the gratitude quote, 74-year-old American author from Minneapolis, Kent Nearburn, says, "It takes a person of great heart to see the wisdom that elders have to offer and to serve them out of gratitude for the life they have passed on to us." And as we enter into this next phase of the pandemic, a phase where we've got the very positive hope of modern science providing a solution that will help save lives of people from this dreaded disease, one that has so unfairly attacked our elders. We can certainly learn from there are many cultures in the world, and certainly our tribal friends and neighbors and partners that here in our state have a deep culture of respecting their elders, and I think we can learn from that as well. And as we continue to take actions, when we're saving lives right now, we're really talking about saving lives of our elders, those that have given so much and created the lives for us. They've fought for our country. They have served, they've created businesses, and they've created the communities that we live in. And with a little extra effort now over the holidays, we can give something back to them until they can receive that life-saving vaccine. So again, the wisdom of elders have to offer, and just let's serve them out of gratitude for the life they've passed on to us. That's from author Ken Nurburn. With that, we'll move to Q&A, and we'll try to give everybody a chance for questions. I guess we're going to start over here on the right-hand side with Jack Dura.
Could you maybe draw the distinction for me between the different dates for the statewide mask mandate of January 18th and January 8th for the capacity restrictions? Why the differences there?
Well, thank you. Good question. The mask mandate on the 18th gives us one incubation period, or sort of two weeks and some weekends past the end of the holiday season. And the mask mandate is the thing that has the least economic impact. And so it is the thing that has proven to be an effective mitigation tool with the least cost to our economy. And so that's the one that we, at least in the current orders, extends the longest. And certainly we do that with the full support of our medical community. We would like to, hope that if we can see a continued decline in the active cases now, that by the time we get into the holiday season, that we might see lower hospitalizations, which would take pressure off the system. But if we have a big outbreak over the holidays, we see hospitalization surging, we know that there's going to be strong insistence by, and rightfully so, by long-term care and by Nurses Association, medical associations, doctors, anybody that works on the front lines or lives with anybody who works on the front line, to keep that in place. So that's low cost and probably the lowest cost and most effectiveness of all the tools we have. On the 8th, that relates to the early closures for in-person dining and serving within our establishments. Obviously, they can stay open later than that for takeout and curbside, but there's an economic cost to that. People have to adjust their business models, so we'd like to keep that on as short a time as possible. And again, we're hopeful that we'll see the same kind of numbers coming out of Christmas that we're seeing coming out of Thanksgiving, and then we can make a decision that first week in January. We'll have time when we come back after the New Year's to make that assessment, but right now that expires at the end of that week. And so that's the timing of the two. And of course, we're resuming high school sports activity, so that executive order is just going to expire, and so we'll be back. So that's adding risk back into the system. So we're adding more interaction and more potential moments where you could have transmissible moments. So we want to see the balance of that. So we're taking some risk on and we're adding some risk back in by adding high school sports, but hopefully with these other mitigations to get us through the holidays. And again, the holidays aren't just about COVID. They're also a period of time when flu season can strike and there's pressure on the hospital system. So we're trying to take the positive progress we have and hang on to it and hopefully turn that into more success in the weeks ahead.
So do you agree that the state's mask mandate has been effective? You refrained from issuing one for several months and even called it an obsession of the media. Do you agree that it's been effective, this mask mandate?
Well, based on this question, it may still be an obsession, but I would say we had many local mandates that went in. prior to the state mandate, and we've seen across the country states with mask mandates who've continued to see cases rise. So I think this is as they say in statistics, this is absolutely a multivariant analysis. There are so many factors at play. Is it, early bar closures? Is it lack of high school activities? Was it the fact that we had so much death in North Dakota that people actually started to understand that this was real, and so many people friends that got seriously ill that they said, wow, we should take this thing seriously. So I think it was a combination of all those things coming together where people might have just made an individual choice. They might have made a business choice. They might have made a school team choice, which is, hey, if we want to play in the playoffs, let's all stay healthy. So I don't think you can single out one thing, one particular thing, and say that's the reason for the drop. This is a collective win for everybody, and everybody that's done anything for mitigation, whether it's for a day, a week, a month, or if they've been doing it for 6 months, if you've done it even for the last day, you're part of the team that's driving these solutions down. So this is a win. This is a win for everybody. And at the end of the day, I've said it 100 times, but you can put in all the mandates you want in the world, but an individual has to put on a mask. This is individual responsibility at the end of the day. And so I'd say this is a win. This is a win not for mandates. This is a win for the collective consciousness and the collective care of North Dakotans. Okay, I'm going to go circle around this way. So Jacob.
Governor, while you acknowledged a number of factors involving those executive orders from a month ago, do you have a comment on the timeliness of it? Do you wish all of those things that those orders from November 13th affected had taken place sooner?
It's probably a little bit, I'm trying to stay away from being a pundit on other people. It's probably too early to be trying to Monday morning quarterback myself and my own decisions. So it might be a little early to try to be reflective. But I would say that from the beginning, we really had an eye on hospital capacity, and we made the decision when we knew we were up against the wall on hospital capacity. And I'd say that the fact that at the time we put it in, we saw results happen and we saw the line started to go down, makes me think that we did it at about exactly the right time. Because I've talked to other governors, they put in mask mandates early, and people are like, why are we doing this? We don't have hospital pressures, no positivity's low, and then people get fatigue on compliance. And so I think, stepping up to the plate right at the time when people needed to step up to the plate was the timing. If you look at the charts we've shown today, it might say that was exactly the right time to do it. Okay, I'm circling back around, so then Lane and then Dave.
Governor, a while ago you mentioned that the state had to present a vaccine plan to the CDC. Has that plan been submitted and approved? And if so, is that the information that we've been getting today as well as last week?
Since we have Molly here, I'll let Molly, if you could hear that. And I want to make sure for online, I see we've got this one mic up here, but it's or two mics. So if you're in the back, shout loud to make sure that you're being heard, and then I won't repeat the questions. But Molly, were you able to hear?
Yeah.
Okay, all right. Fire away.
The question was if our state has submitted a COVID vaccination plan and if it's been approved. We did submit our COVID vaccination plan on October 16th, and CDC is not approving states' COVID vaccination plans. They did provide feedback on our plan, and so we did incorporate some of their feedback. Even since that October 16th plan, we have been updating the plan every day. And so on our website, we do have our original version of the plan still posted, but we do anticipate posting a subsequent version to reflect all of the new information and changes in COVID vaccination planning.
If there's other questions for Molly, we'll have her stay up there.
Molly. From online, Mike Smith, 660 KEYZ in Williston. One thing I've been seeing with those against the vaccine is that producers are not liable for any issues that may occur with the vaccine. Is this something specific to the COVID vaccine, or is this the norm when it comes to developing a vaccine?
That's a good question, and I have also seen media around that. And so, first of all, let me say that vaccine manufacturers are not liable unless they're negligent. And so they're not exempt if they're negligent from any sort of liability. But in order to get manufacturers to want to produce vaccines and have an incentive to produce vaccines, and this applies to all vaccines, not just COVID vaccine, the federal government has made them not liable for any unforeseen adverse events associated with the vaccine. And so there is a difference between which program is going to cover it. And so the National Vaccine Injury Compensation Program usually covers routinely administered vaccines in the United States. For COVID-19 vaccine, that will be covered under the PrEP Act, which covers all countermeasures. And so if there is any injury due to treatment or from the vaccine, then that fund would cover any of those expenses. But if they're negligent in any way, they would still be liable. This is just from unforeseen adverse events that they would not be liable. Yep.
You mentioned these 40,000 doses that the state is hoping to receive by the end of the year. In this first wave of healthcare professionals and long-term care residents that receive a dose, then obviously they'd need a second dose after that. When will we start seeing those people gain immunity and possibly some relief on the healthcare system?
I don't think, immunity in the clinical trials was calculated that 95% efficacy was calculated 7 days after the second dose. And so for the Pfizer vaccine, the 2 doses are 3 weeks apart. And for the Moderna vaccine, the doses are 4 weeks apart. And so we can expect to see some immunity even potentially after the first dose, but really after people receive both doses. And so for the people initially vaccinated with our first shipment of Pfizer doses, they could be receiving their second doses the first week in January.
Well, refer to the 82% you mentioned earlier.
Yeah, and so it's looking like the Pfizer vaccine does offer some protection after the first dose, and that, according to the clinical trial data, was 82%. Yep.
Will you remind me just how many healthcare professionals you said are in the state about?
Yeah, sure. So the question was how many healthcare professionals are in the state of North Dakota. It's a little over 68,000. So we're saying about 70,000 healthcare workers, and then about between 11 and 12,000 people in long-term care. And the definition for long-term care includes skilled nursing facilities, basic care, assisted living, but it also includes group homes for adults who are unable to live on their own.
So then with those 70,000, if we're only expecting 40,000, are we just not expecting the uptake that we might see, or are you concerned that people just aren't going to want it, or are you concerned that we might not have enough?
So the 40,000 doses that we're expecting, that's just through the end of this month. And so there will be subsequent doses after December. We don't really know what the expected uptake is going to be amongst healthcare workers or long-term care residents. I'm sure it will be above 50%, but we don't know what it will be. And so we'll be monitoring that. And as soon as we start seeing a slow in uptake is when we would move on to other phases of vaccination and subsequent priority groups.
Have you guys been surveying people in the hospitals, I think, a little bit on that issue?
The hospitals themselves have been surveying their staff as to their willingness to receive COVID-19 vaccine, and they've received various results. Some of them, a lot of the surveys were done prior to even having data on safety and efficacy of the vaccines, and so I would have to let the hospitals report out those results of their surveys, but the vast majority were over 50%.
Perhaps you don't know this yet, but of those 40,000 doses expected by the end of the year, is there a breakdown of long-term care residents versus healthcare workers that would receive those doses?
Through our planning, and let me say that's an estimate, and so we are using the 40,000 doses as an estimate to plan for weekly allocations moving forward, but it definitely can change based on vaccine manufacturing. But we have planned out those doses, and so we do plan by the end of December to allocate all doses that would be needed for long-term care. And then it also covers a significant majority of our healthcare worker population, approximately 60%. Dave?
My question is just how many, do you have enough facilities now to store the vaccine at, was it minus 70 Celsius?
Yeah, the Pfizer vaccine does require ultra cold storage down to negative 70 Celsius, and this isn't something healthcare providers traditionally have on site. We have identified facilities across the state that have ultra cold storage, and then also our state warehouse has procured ultra cold storage, and so they're able to store doses as well. And then the one thing that we maybe haven't talked about is Pfizer is shipping those doses in a special shipping container that can maintain ultra cold storage for 30 days. And then Pfizer's vaccine also has 5 days of refrigerator stability. And so I do think we have adequate ultra cold storage in this state, and we will, as much as possible, prioritize the Pfizer vaccine for facilities that have that type of storage, as the Moderna vaccine requires normal frozen storage in just a regular freezer and has 30 days refrigerator stability. Yep.
For the medical workers that will be receiving the vaccine, is there a priority of whether or not they have already tested positive or not tested negative for the virus?
So facilities can determine their priorities for healthcare workers who will be vaccinated. It's likely, although it hasn't been officially decided yet, that people who have previously tested positive for COVID-19 will be recommended to receive the vaccine. However, there are some discussions at the federal level that if it's been within the last 90 days that you had a positive test, you could potentially be prioritized lower than other individuals. And so we're hoping that the Advisory Committee on Immunization Practices, who's meeting Friday and Sunday, will provide some of that guidance as to whether or not and when to vaccinate people who were previously positive for COVID-19. Any other questions? Okay.
Molly, one more for me.
Oh.
You want?
Uh-oh.
You covered this last week, but maybe help people understand the payment, how the federal government is making this available, and whether they have insurance, not insurance, but the whole sort of how do I pay for a vaccine?
Yeah, sure. So the federal government wants to ensure that taxpayers have no out-of-pocket costs for COVID-19 vaccine. And so all of these vaccines are being provided at no cost, and providers can charge a small administration fee for the vaccine. However, if an insurance, it will be covering the cost of that administration fee. However, for people who don't have insurance and are unable to pay that admin fee, they will not have no out-of-pocket costs and can't be turned away. And healthcare providers will be able to submit a claim to HRSA to reimburse their costs if they do vaccinate individuals who are unable to pay that administration fee. All right.
Free for everybody.
Yeah, free for everyone.
Thank you, Molly. I guess maybe we'll go online. Danny?
Scott Penn and I'm forgetting which. Besides vaccines, what is the state doing to investigate other existing drugs and/or treatments? The U.S. Senate has been holding hearings on proven treatments that don't seem readily available to North Dakotans.
Well, on Scott's question, there's a lot happening on that front, and the best people suited to answer that would be our medical providers, but there's been great advancements made on therapeutics across the state. And of course, I think one of the things that coming out of the backside of this we'll understand is that if you, places in the world that had healthier populations, people that had lower incidence of diabetes, lower incidence of obesity, less heart disease, less smoking, this COVID is tough on people that have underlying comorbidities, as we've been saying that since the beginning. But it goes to say then if you have a population that has better diets and more exercise and more sunlight, higher levels of vitamin D in their system, maybe more vitamin C, then they're going to have more natural immunities. So I think when this gets done, we're going to see that. And of course, we've got also in our state, we've got the challenges that this virus appears to have more transmissible in lower humidity environments that are indoors. And so I think, again, part of the reason why we're having a battle up here is because we don't really have this time of year the opportunity for outdoor dining and other activities that are available elsewhere. But we'll log that as a great question, and maybe we can get some healthcare providers at a future meeting to dive more deeply into that thing. Dave?
Governor, will the rapid testing be available for the general public, and if so, when?
The current plan right now on the rapid testing that we have is through all the groups that I talked about, because we are looking for and reaching out to, and I'd say if people raise their hands, is with the rapid testing works best if people will agree to be tested on a regular basis. So if you've got a group like, say, the Cass County Sheriff's Department, they've raised their hands and said, hey, we'd love to have everybody tested once a week. Firefighters, teachers within a school building. If we can be in a regular rhythm of testing the same people, the same number of days apart, then this differential between the sensitivity of a PCR test and a rapid test really goes away, because you'd be catching people as they're incubating and getting them out of the system. And so, and again, with this cost differential, you could test somebody every week for 24 weeks for the same price as one PCR test, if it's call it a 24 times difference in the price of the test. And so then, that opens up, wow, you want to test somebody once, or do you want to test them 24 times? Well, I can test them once a week, 24 times. You test the same population, and each time you find a few positives, you pull them out of the system, find a few, pull them out. Pretty soon you're going to find out that you've wiped out the virus in that population. And so it's a different strategy for surveillance testing, but we need groups of people where we can test the same people each week. If there are parts of the general public that say, hey, we would love to, submit for that, I would just, reach out to us, because we've got a lot of these tests. We want to use more of them. Jeremy?
Governor, there's obviously a lot that could happen in the next month or so. I'm wondering, though, if conditions don't improve necessarily with hospital capacity, would you consider extending any of these measures that you announced an extension to today?
Same answer I've given all along, which is we're going to do whatever we have to do to make sure that we manage our hospital capacity in a way where every North Dakotan, whether it's a COVID or non-COVID, can be assured that if they need care, that the care is going to be there. And we also, I think, have a responsibility to try to carry on the victories that we've been getting the last 2 weeks in terms of declining cases. It's hard to use the word victory when you had 102 people die in the last week, and hospitalizations are still too high. But it's a victory because it likely means they're going to have lower hospitalizations 2 to 3 weeks from now, and we're going to have less deaths 2 to 3 weeks from now. So that's where, these are trailing indicators, but the risk that we have right now are at least threefold. One is that the rest of the nation is blowing up, and so people that are traveling to or from the rest of the country, we're not an island. I was on a call earlier today with Western Governors Association, and 2 of the governors that are on there, the Governor Guerrero, she's the leader of Guam, and Governor Ige of Hawaii, they're on islands, literally. They got health forms. You land, you fill out a health form, you quarantine for 14 days. They're on an island. North Dakota, we're not on an island. And so we've got a lot, there's an enormous amount of travel during the holiday, and when the rest of the nation may be seeing record cases, that recommends risk for us. And then we've got we've got the flu season, if you will, which is a time when normally puts more pressure on hospitalization. So yes, we're going to keep our eye on that number which we share here, which is, we finally got below 300 after more than, a month. We'd like to get that number, below 200 back to 100 to give us capacity. But if it's going down at a slower rate than demand for hospitalizations are going up from all non-COVID, we got to manage the whole system, because as we've said before, we're not going to, the traveling nurse option at a time when the rest of the nation is blowing up is not something that we can count on, and it's not anything that's ever really been affordable. And so we've got to figure out a way to get through this ourselves. So we're going to keep doing what we need to do to make sure that we manage all those factors. We will know a lot more the first week in January than we know now. This is a business where every day you learn a little something more, and every couple weeks you learn a lot more. And we're also going to be by that time we'll know everything that Molly talked about is plans. Hopefully we'll be standing here in the first week in January and saying, hey, we've administered 40,000 doses. We've had success. There's more doses on the way. I mean, we're actively in the thick of it, but I tell you, we're right now, I wouldn't trade North Dakota's cards with anybody's because we're one of the few states that's got our positivity rate and our case rate going in the right direction at a time when it really needs to go the other way because of these factors of the holidays, of travel, of the nationwide cases increasing, and of the flu season putting pressure. So there's a lot of negative, there's a lot of downward forces that are opposing us, that are creating risk, and we're in a position where things are going so well, we're actually able to add a little bit of risk back by opening up high school activities.
And then just to follow up, what would be like an acceptable level of hospital capacity? Is there a threshold that you're looking at where you would relax some of these mandates?
Well, there's not a specific number, and it's not just COVID related, because in our daily stand-ups that we're having with all of the chief nursing officers and chief administrative officers of the hospital organizations, we're of course looking at how much staffing they have, how many people do they have that are out due to COVID, how many ICU beds are available. As Molly talked about, I mean, one of the strategies that we're deploying here in an effort to, you protect the most vulnerable two ways. One is you protect them directly by giving vaccines to people that can be protected that are vulnerable. And the second way you protect the most vulnerable is protect healthcare workers that are going to be available to care for them. Because we had a time in the last month where one of our hospitals reported that they were 18 beds. They had 18 fewer staffed beds that day than the day before because of the number of people that were out due to COVID. So the number of staffed beds is going up and down based on COVID cases and COVID close contacts. So we start protecting the healthcare workers with the vaccination. That's going to create stability and capacity in our ability to have hospitalization. We get the long-term care stuff. That's going to get less people that need hospitalization. I mean, so all of these things, the mitigation efforts are the stopgap to get us to where we can have a real solution. Okay, Morgan?
My question is about the winter sports resuming. Will the other executive orders kind of trickle down into the sports issue? Will the capacity limits affect the amount of spectators that can be there? And will there be a mask order on players? They're not distancing, so would they be exempt from that?
I'll refer some of these specifics to the North Dakota High School Activities Association, which sets the rules for the North Dakota high school sports. We had the executive order which limited their ability to practice and hold games. Now that those are expiring, the capacity limits because as of December 14th, there will be no executive orders against high school sports. They're operating free of the executive orders that are expiring. The North Dakota High School Association board this morning adopted capacity rules that are in line with the North Dakota Smart Restart guidelines, and so they were trying to match up with those so that communities and others could understand. But prior to today, they had just a straight, very simple understand. Prior to today, they had a 50-person per activity limit. By going with the North Dakota Smart Restart guidelines, which is a choice they made, they're actually raising the limits in terms of how many people can attend high school sports. But those smart restarts are based on capacity. So if you've got a larger facility, say you got a Christmas tournament at the Bismarck Civic Center, and that's at 25%, then that you get more people there than you could in the gym in Arthur, for example, where they no longer hold games. But that would be an example. So it's a little complicated, but I'm positive each school district can very quickly figure this out, and they can work with North Dakota High School Activities Association to be able to sort through that.
And then just a follow-up question: what would happen if, say, one school district wanted their students to wear masks while they were playing and another didn't? I'm the least sporty person probably in this room, so if that needs to be explained a certain way, that's fine.
Yeah, I guess, I don't know how they would sort that out. I guess that would be coaches and school boards and superintendents would be working with that on a local level. But I do want to say thanks to Matt at North Dakota High School Activities Association and his team and all of the school boards and superintendents and everybody, all the parents and coaches. It's one of the factors that has contributed to our decline is that we took a little bit of a pause here, and I know that was painful for some, but we're all in this thing together. Everybody's actions made a difference. We've got some of the best trend lines in the country right now, and everybody in North Dakota at all ages ought to feel like they're on the winning team. This is a really important that everybody feels ownership in this across the state, because it was everybody's got a reason to be proud of these results. Okay, thank you very much. Have a great rest of your day. Stay healthy, and we'll see you next week.